Good morning, friends. Today we will discuss another topic related to Kaumarbritya, that is Introduction to Panchakarma in Pediatrics. Panchakarma in children is always a controversial issue. The age factor of the children is the basic issue of everybody's concern. And commonly asked question is, can we give Panchakarma in children? And if we give Panchakarma in children, what are the modifications should be done? Is it same as that of the adult Panchakarma? Likewise, we will have many questions whenever we deal with Panchakarma in children. Panchakarma is a purificatory method to root out the disease, as we know. And Shirodhara is important mode of removing the vehiculated doshas from the body. Now, as we know, dosha prakopa occurs in all age group, including children. We know that it happens in adults, but even in children also, whenever there is a disease, there will be dosha prakopa. And Panchakarma is required to remove the vehiculated doshas which is deeply rooted. Now, disease may be chronic at any age group. Usually we prefer Panchakarma treatment for the chronic disorders. The disease may be chronic even in children and even in case of adults. Hence, it is the right to have Panchakarma for all age group, including children. Hence, Panchakarma is also indicated in children. Further, it is also told that administration of the Panchakarma should be done by considering Bala, Kala, Desha, Vaya, Dosha and Dushya of the patient. Hence, it is not the age which is the limitation, rather it is the Bala and other factors which should be kept in mind. In case of children, when we provide the Panchakarma or when we administer the Panchakarma, instead of focusing more on the age group, we have to focus more on the Bala of the patient or Bala of the child, and also Kala and also Desha. Vaya and other factors comes later. Why Panchakarma is important for children? Health, growth and nutrition in the childhood is the base for the future development. So childhood disorders should be treated to avoid the complications, because even some of the childhood disorders also may lead to future complications. To avoid such things, we have to give Panchakarma for children. We have to remove the vehiculated doshas very judiciously. The reason why we have to remove the vehiculated doshas in a judicious way in children, because as Kashyapa says, doshas and dhatus are not completely formed in children. Incompletely formed doshas, when removed, we have to also modify the procedure. Panchakarma should be given by using Madhura Pradhana, Hridya, Shita and along with the estimated dose and with a slight modification of the procedure. As for Kashyapa Samhita, physicians of Kaumarbritya will be always under great stress. Bishak Kaumarbrityaste Karanam Nityadukkitaha. Hence, the proper diagnosis with a high index of suspicion is required in child before implementation of the Panchakarma Chikitsa. Kashyapa says, the development of the symptoms are not complete in case of children. Development of the doshas are also not complete in case of children. And there is no chesta ingita, that means the presentation of the signs and symptoms is also not up to the mark. Child is not able to orally express the feeling, good or bad feelings. By considering all these factors, when we administer Panchakarma in children, it should be very judiciously. And the physician who is dealing with all these things will be definitely under stress, and it is a challenging situation for the physician of Kaumarbritya. Vamana, Virechana, Basti, etc. procedure will always demand an active participation of the patient, and the passive administration may be quite dangerous. So newborn has got functional immaturity, but still there will be dosha vitiation and also the vitiated doshas through the breast milk. We know that breast milk is the way of feeding, mode of feeding in first few months of the life, maybe up to 1 year. Therefore, the vitiated doshas from the breast milk, stanya, also enter inside the newborn baby and cause the dosha vitiation. Different opinion among the scholars of Ayurveda regarding the implementation of Panchakarma in pediatric clinical practice has been observed in the science. Some of the scholars resist as they stick firmly on classical references, while others support as they get desired result clinically by its judicial administration. This is commonly seen in clinical practice. When we go to the pediatric clinical practice, few of the physicians very strictly adhere themselves to the classical references and they never administer Panchakarma in children. But few of clinical practitioners, they practice Panchakarma in a judicious way and they get a very good results. It is obvious from the classics that Panchakarmas are indicated in children, although age group is not specific. Of course, age group is not specific when to start Panchakarma, but still it is very clearly mentioned that even in children, Panchakarma should be given. Kashyapa, that moderate or minimum level of Panchakarma can be given in children comfortably. This is what Kashyapa says. Kashyapa says minimum level of Panchakarma in a minimum, mild or moderate way can be very safely given in children. Meanwhile, there is a clear-cut contraindication for excess apatarpana, rakta mokshana and shodhana also. Kashyapa also says that the Panchakarma procedure should not be given in excess in children. Therefore, he says, Natu eva balasya vishoshanam hitam, naiva ati samshodhanam na rakta mokshanel. And mild and moderate Panchakarma should be given by using snigdher, sushithir, madhurer, adahir, and ashana, lepa, sechana. These are the mode of administration. So, medicine should be containing preferably more snigdha drugs, shita drugs, and avidahi drugs, and the form of anna, ashana, and lepa and parishechana should be given. This is what is told by Kashyapa. The point is very clear. Panchakarmas are not contraindicated for the children. Only thing which is told by Kashyapa is it should not be given in excess, and it has got some limitation, and the usage of the medicines should be comfortable to the children. Now, limitation and as well as solution. It is clear by the version of Chakrapani when he explained two types of children with respect to pediatric Panchakarma as Swatantra Bala and Paratantra Bala. Panchakarma can be very safely employed in Swatantra Bala or independent child by considering Bala, Desha and Kala, etc. Here, the Swatantra Bala refers to that child who does not require any assistance in its day-to-day activities like eating, talking, walking and explaining the good and bad suffering during the course of treatment. While Paratantra Bala is who is depending on the parents or caretakers for his all day-to-day activities and not fit for the same. The shloka which is given by Chakrapani is very clear. Dosha dusha malamshaiva mahatam yadayashchaye ta eva sarve balanam matratu alpataramataha nivrittir vamanadinam mrudutvam paratantratam. So this is told by Charaka. Now the last line nivrittir vamanadinam mrudutvam paratantratam. So commenting on this, Chakrapani very clearly mentioned this shloka. So he says that yato mrudutvam paratantratacha balanam iti Vag ityadi vakcheshtayor samarthyam vikshya baleshu yatha vyadi beshajam alpamatram prayojayet madurani kashayani chiravanti mriduni cha prayojayet. So it is clear that according to Chakrapani, the children are classified into Paratantra Bala and Swatantra Bala, and in case of Paratantra Bala, Nivrittir Vamanadinam, Vamanadi karmas should not be given, whereas in case of Swatantra Bala, all the Panchakarma procedures can be given by modification according to the need with a slight modification. Both mother, now need of Panchakarma to the mother and child. We know in the classics, always when we talk about newborn, always the mother is also associated. Both mother and child, the Shodhana should be administered when the condition demand, and this is true just like a letter written on the stone, Shila Lekha. This is also told by Kashyapa in Vamana Virechaniya Adhyaya. That means that both mother and child should be given with the Shodhana. That means Panchakarmas are also given to the children. And this is true just like a stone, a letter written on the stone. Further, it clears all the contradictory opinions regarding administration of pediatric Panchakarma. One thing is very clear, pediatric Panchakarma should be given. Children should be given with the Panchakarma. There are some limitation, there are some modification needed. Shishor vyado samutpathe datrinam eva shodhanam atam balam sukha yeti ko lokehe navavudnyate yastu kayagatastasya doshanam pura sanchayaha ubhayostu yada samyak shodhanam kurute bishak tada arogyam bhavatyashu shishor lekha yatashmani. This is just like the letters written on the stone, Shila Shasana. It is true that even children should be also given with the Shodhana procedures along with mother. In the infantile age, it is vitiated breast milk of the mother through which the disease is manifested in the baby. Therefore, we will have maximum stanya dushita vyadis. Although mother has been advised to undergo Shodhana to get rid of the disease, the morbid doshas which get settled in the infant's body by undergoing sthana samshaya definitely cause the further disease sequel and can destroy the life of the baby. So by considering this morbidity, the classics explains Shodhana or purificatory measures to the child. Of course, certain limitations like too young age, strength of the child, drugs used like paya, madura, shita ahara, agni should be kept in mind while administration of the Panchakarma. As for the classics, all Panchakarma are safely administered in child except some contraindication for Virechana. This is very clearly told. As for classics, all the Panchakarma are safely administered in the child except some of the contraindication for Virechana. Shishunam ashishunancha basti karma amritam tataha yataha Bishajam artamashasihi shishorayu prajaha pituhu. So now, these slokas, very kshirapasya shishordeyam aushadam kshirasharpishaha datrashtu kevalam deyam kshirena api sarpisha. We will discuss this sloka in the following slides. These are some of the references where Panchakarma is indicated in children. Now, to some extent, the alterations in Panchakarma with regards to pediatric practice has been explained in the classics. Bala is the stage with the delicate body and mind with the dominance of the kapha. Hence, kapha means it's unstable kapha. Hence, the mrudhu vamana with full stomach milk or breast milk followed by tactile stimulation of the throat has been indicated. In the previous shlokas, we got this reference. We have this reference. Okay? So they says in case of Bala, everything is delicate and there is dominant of kapha which is unstable. Hence, we have to go for mrudu vamana. Vamana should be given, but it should be mrudu vamana. How to induce this vamana? Go for full stomach milk or breast milk followed by simple tactile stimulation of the throat. This is one reference. Next, further Ashtanga says, indications of Virechana. Whenever in children or small kids, there is indication for Virechana, a vyadhi that demands Virechana. But whenever we have to give Virechana, indication is there for Virechana, it should be substituted by Basti. And whenever there is indication for Marshanasya, it should be substituted by Pratimarshanasya. This is very clearly told by Ashtanga. Kashyapa further explains Vamana as a mainstay of treatment in Bhala Rogas due to the dominancy of Kapha dosha by indulging in Kapha Vardaka Ahara like Kshira, Grita, etc. This is also given by Kashyapa Samhita that as child consumes more Kapha Vardaka Ahara in the form of the breast milk or gritas, etc., the mainstay of the main reason for all the disorder is Kapha dosha, and as a result to remove this excess Kapha, we have to go for Vamana, and Vamana is the mainstay of treatment. Virechana in a child in a Pitta Roga has been also indicated. If you go to the classics, in a child, even Virechana is also indicated, but it is always better avoided. It is suggested that to avoid Virechana as far as possible and reserve the same only for the emergency condition, cha atyaikanam. If it's very, very emergency, then only go for Virechana in children. Otherwise, don't go for any Virechana in children. Substitute the Virechana by Basti. Lastly, Basti is indicated for the child and told that it imparts arogya to the child, or offsprings for the parents, and name and fame for the doctor and consider as nectar for the child. Shishunam, Ashishunam, Bastikarmam, Amritam. So therefore it is considered as nectar because by Basti they says that three persons will be get benefited at a time. Basti gives a life for the child, Basti gives the offspring for the parents, Basti gives name and fame for the doctor. Panchakarma in infantile periods. Kashyap also advises Nasya for both child and mother. And in the Nasya Karma Adhyaya of Siddhisthana, he says, you have to forcefully administration of the Nasya to the child if absolute indication is there. In case of, it's very, very important. He says that if a condition demand Nasya, then forcefully administer the Nasya to the child. And if the child is reluctant, in order to prevent the future complications. If the child is reluctant, don't worry, forcefully administer the Nasya to the child. At least it will prevent the future complication. We find many instances of indication of Bahya Snehana, 8 types of Svedanas, Agni Karma, Rakta Mokshana, etc. in different disorders in relation to children. Certain conditions where mild Panchakarmas are employed in infants without Snehapana as the child is routinely consuming the milk and Snehana substance. We also find some references where the Panchakarma procedures are explained for the children without Snehapana. The reason given is child is already taking Snehapana drugs daily in the form of the milk and Grita etc. Therefore, there is no need of internal Snehapana and we can directly go for the Shodhana. Similarly, during Prana Pratyagamana procedure, the Vamana has been done to clear the stomach from the liquor amniae and meconium-like substances. Of course, it is considered as Sadhyo Vamana. Grita and Saindava is given to induce the Vamana in a child immediately after newborn. Although this is not the classical Shodhana procedure, this can be considered under Sadhyo Vamana procedure. Certain Graha Rogas affecting the infants, there is indication and contraindication for the Vamana and Virechana. If you go for the Revati, if you go for the Naigamesha, we find many such instances where the Vamana is indicated and Vamana is contraindicated, Virechana is indicated and Virechana is contraindicated. Now, Shishu Vamana is also indicated in disorders of the breast milk vitiation like Kshiralaka and Kukudaka. While explaining the Snehana to the child, Snehadravya of Jangala and Sthavara Yoni administration, indication, contraindication, and the Sneha Ajirna and Samyak Lakshanas are also explained. In Kashyap Samhita, there is a separate chapter called Sneha Adhyaya in Sutrasthana, where they have mentioned different types of Snehana Dravyas related to Jangala and Sthavara origin, and their administration, indication, contraindications, everything is explained. After taking the Sneha Ajirna Lakshanas are also explained. Now, Grita, Taila, Vasa, Majja are explained as major Snehana substances, and more importance has been given to Pravicharana Sneha with the same materials. If you go through Kashyap Samhita, we find more importance to Pravicharana Sneha instead of Achapana Sneha. Kshirapa Avastha of the child does not demand compulsory Snehapana due to daily intake of the milk and oily substances as it is the main diet. This I have explained earlier. Avika Grita is especially indicated for Prameha by Kashyapa. Several Bhaishya Snehana methods like Abhyanga by Rajatela, Mardana and Samhanana etc. are also explained in Kashyap Samhita. Certain Bhashya Chikitsa in children. Svedana is indicated in colicky pain. Matra Basti is indicated in constipation-like condition. Parisheka in seborrheic dermatitis. Abhyanga in muscular pain. Chest massage in breathing difficulty. Abhyanga to the nabi in warm manifestations or other atypical abdominal pain. Svedana in urinary and fecal retention. Svedana over the abdomen and suprapubic area. Arka Lepa in case of corns and warts. Patta Bandhana in case of contractures because of cerebral palsy or some other physical disabilities. Shirodhara in cognition problem, mental retardation and autism-like conditions. Some of them are explained in the classics and some of them are very relevant in the clinical practice. These are This is a picture. Now, talking about Abhyanga. Abhyanga works by modulation of the sensations. In children, Abhyanga works by modulation of the sensations. Abhyanga can be done by using oil, grita, vasa, etc. as we know. Different types of tela of vegetable and animal origin oils has been used for the Abhyanga and also explained in Kashyapa Samhita. Whenever there is a aching pain and inflammatory pain, practical knowledge says that Nirgundi Taila, Mahavishagarbha Taila has been found effective. Or, in other words to say, when there is ama-like conditions which is localized at the local place, like joints, etc., this type of Nirgundi and Mahavishagarbha Tailas are explained quite effective. Pain with the tingling sensation, as in seen in case of neurological disorders or degenerative conditions, Prasarani Taila is very good, and it has got Vedana Stapana property also. The Vedana Stapaka drugs re-establish the Vedana or sensory perceptions in the given part of the body. Vedana Stapaka does not refer to painkiller. Vedana Stapaka refers to re-establishment of the Vedana, that is sensations. So this is quite useful in case of sensory problems. In certain conditions of neuromuscular disorders with atrophy, like spinal muscular atrophy or some other conditions of the skeletal muscles associated with the pain, the Mahamashadi Taila or any other Brahmana Taila is quite good. Mahamashadi Taila is considered as Brahmana Taila or bulk promoting and nourishing Taila, which is also added with Mamsarasa, which provide easily absorbable animal proteins. Vague pain all over the body due to dry skin, especially in winter season, can be very well managed by Eshti Madhu Taila. I am giving details of use of Abhyanga in general clinical practice. Pain in joints due to degeneration or inflammatory origin, as occur in case of juvenile rheumatoid arthritis, Amavata, Vishagarbha Taila, Mahavishagarbha Taila or Lagu Vishagarbha Taila is quite useful. Kashyapa very clearly says in case of Fakkaroga, where there is failure to thrive and also loss of body muscle mass, Raja Taila, which is used for the Abhyanga, is quite useful in atrophy of the muscles. Decrease the range of movement in joint and muscular contractions along with the formation of the contractures and spasms, Sahacharadi Taila and Pinda Taila is quite beneficial. Mahanarana Taila is quite good in case of growing pain in children. In case of bronchial asthma, Uru Abhyanga can be followed. Lavana Taila or Brihat Saindavadi Taila is quite beneficial for bronchial asthma cases during the time of the attack or routinely. If you go for Uro Abhyanga by using Brihat Saindavadi Taila and or any other Lavana Tailas followed by Swedana gives a very good results. Kapha in the bronchial asthma and other Kapha Purna conditions of the chest act like chest physiotherapy. This particular Uru Abhyanga will act like a chest physiotherapy and helps in the vilayana of the kapha which is present inside. The local application of the Ksheerabala Taila over the eyeball and eyelid area by Ksheerabala Taila gives much relaxation, and especially in computer vision syndromes or excess use of the electronic gadgets, and the children are having the dry eye and also eye pain. The nighttime application of Ksheerabala Taila over the eyelid area and with a mild massage is quite beneficial. Anal area by Katu Taila is quite useful. Anal itching which is caused by the pinworms, where Katu Taila mixed with the lavana and kept over the anal area by soaking it with a gauze piece is quite beneficial at night hours, as mentioned by Kashyapa. This reference is also present in Kashyapa. He clearly says, so in case of Krimi Roga, go for Katu Taila application over the anal area. Another condition is Mukalepa. Another procedure is Mukalepa. Mukalepa with the Eladigana lepas or Eladigana drugs, Yeshtimadhu or Amalaki is quite useful in fungal infections of the face. White patches and acne vulgaris like conditions also can be best managed by this Mukalepa with the above mentioned drugs. Certain dermatological conditions with oozing lesions, should be applied with the drugs of Shoshaka property, Lepa. I am talking about some of the Bahya procedures which are useful in case of children. So, dermatological conditions with the oozing is there, then go for Shoshaka property like Kashaya Rasa drugs. Dry skin, most commonly we use kashaya rasa drugs or tikta rasa drugs like Nimbapatra kashaya or Pancha Valkala kashayas. Dry skin lesions with itching and lichenification should be applied with the drugs of Madura kashaya rasa and snigdha nature. When the lesion is very reddish, go for Manjishta Lepa. Lepa in case of macule patches, as seen in case of Shvitra. Application of Gajalinda Lepa, Bakuchi Tela and Putika Lepa is quite useful. Lepa in case of streptococcal and atypical bacterial infections of the children can be best managed by Nimbapatra, Karanjapatra and Saptaparni, Twak, Kwata, etc. Medicated water is prepared by using this Nimbapatra, or rather Kashaya is prepared by using Nimbapatra, Karanjapatra, Panchavalkala Kashaya and Saptaparni Twak, and using it for bathing and washing is quite beneficial in case of some of the superficial streptococcal or atypical bacterial infections. Rukshapatra Pinda Sweda can be best used in case of Lepa form for the joint pain, as we know. Even Valuka Sweda can be also used. Avagaha and Parisheka. Avagaha and Parisheka are good in some of the skin conditions, as I mentioned earlier, can be very well treated by Avagaha Chikisa. Ichthyosis like conditions can be very well treated by Gomutra Avagaha to ensure the Shotoshodhana and opening of the sweat glands. Certain Sweda drugs are also used. Avagaha of Panchavalkala Kvata, Nimbapatra Kvata is quite useful in certain atypical skin infection. If Avagaha is not possible, snehana can be also done by using kashaya of the same drugs. Usually we practice a tub bath. Child enjoys this tub bath and meantime treatment is also possible. If for the children, prepare this kvata and put it on a tub and ask the child to be there in the tub for 10 to 15 minutes. Baby enjoys by playing. Shirodhara is a Bahya Chikitsa which is also useful in pediatric practice. Shirodhara is quite useful in certain neurological, neurodegenerative, psychological, behavioral and cognitive disorders of the childhood. This is quite effective when it is done after mundana, that means shaving of the hairs, scalp hairs. As pediatric clinical practice, we come across with certain conditions like cerebral palsy, cortical atrophy, neurodegenerative disorders, autism, mental retardation, learning disabilities, attention deficit hyperreactive disorders. Application of Shirodhara by using different thaila and medicated water, takra and as well as mutra is quite useful. At times, application of Shirodhara may be quite difficult in non-cooperative child, especially mentally retarded child or ADHD, etc. In such condition, instead of Shirodhara, we can just modify the Shirodhara and administer Shiropichu. Shiropichu is nothing but the modification of the Shirodhara, where certain thailas are soaked in a gauze piece and kept over the anterior fontanelle and allowed to get absorbed. Unossified anterior fontanelle of the children give a chance of absorption of the oil through the soft tissues areas of the skull. Shiropichu is substituted by Shiro Lepa at time for convenience. Application of certain raw drugs in the heated Lepa form over the scalp. Lepa of Medhya drugs in cognitive disorders is quite useful like Shankapushpi, Jatamamsi, Vacha, Jyotishmati, Brahmi. Lepa of Yashtimadu, Maricha, Tuvaraka, Karanja, Nimba, Spatika, Tankana is quite useful in fungal infections, especially seborrheic dermatitis like conditions and also in local wounds of the scalp and premature graying of the hairs, etc. Shirolepa with the Tikshna and Ushna drugs are quite useful like Vacha, Pipali, Jatamamsi with Gomutra after Mundana are quite useful in autism like conditions. Shirolepa with Shita, Madura, Snigdha drugs mixed with Gomutra is good in ADHD like conditions. Shirolepa with Majja, Vibhitaka, Aragvada, Ballataka Majja, etc. can be tried. Of course, we have very less clinical experience on this. Can be tried in case of cortical atrophy like conditions. It can be also given orally. Premature graying of the hair, hair fall, alopecia areata and other fungal infections leading to the hair fall can be best treated by the lepa of Amalaki, Spatika, Tankana, Vacha and Eshtimadu in Tulsi Patra Surasa. Role of Shirodhara, if you see, Shirodhara, Shirobhasti, practically difficult in cerebral palsy or some of the childhood conditions. So therefore, it is always preferable to go for Shirolepa, Tala, Shiropichu, Shirotarpana, Talapotachil, etc. or Shiro Abhyanga, etc. This can be even conducted by the patient in home on daily basis. Practically, Shirodhara is quite difficult to conduct in cerebral palsy due to lack of cooperation and also due to postural problems. Shirodhara works by modulating the brain function. It helps in altering the concentration of the neurotransmitters inside the brain. We have got excitatory and also the inhibitory neurotransmitters, and the balance between these two neurotransmitters by modulating the brain function is done by Shirodhara. It decreases the excitability of the neurons. These are some of the pictures. So this is about snehana, the basics of Panchakarma in children, and also about the snehana. In the next part, we will discuss about Panchakarma in pediatrics, about Svedana. Thank you very much.